Hey everyone, welcome to my platform. My name is Dr. Doc Barrak from Washington, D.C. I was born and raised in Beirut, Lebanon. I came to the States about 7 years ago to pursue a career in medicine, as I've always wanted to be a doctor ever since I was a kid. So I've decided to create this platform to address some of the misinformation that keeps popping up all over social media. My goal is to really arm you with the right tools that are necessary for you to make informed decisions about your health. One of the most toxic topics I'm seeing today is the quality of the information that's available on the internet. You know, as healthcare professionals, the quality of our care is as good as the data that's presented to us. So we're going to be discussing data. How do we really identify good sources of information? How do we put it in the right context? We'll also be talking about conflicting data, and by that I mean there sometimes could be good sources that are giving us different types of information. So I'm going to help you go through that and navigate how to find out which one is correct. We'll also be talking about a wide array of medical topics, some of them revolving around the pandemic. I'll also be focusing on cancer, the well-known risk factors. How does genetics and how does the environment play a role in what we call carcinogenesis? We can also talk about screening tools, diagnostic tests, and what we call cutting-edge technology in the management of both early and late stages of cancer. So let me give you a bit of a background about myself. I started off as a physician scientist over at USC in Los Angeles. I also completed my master's in public health after that. So I was able to design scientific studies, analyze large data sets, and get comfortable with cancer biology and mainly circulating tumor cells. I am currently in the Department of Surgery over at Georgetown University, part of the MedStar Health system. And next year, I'll be pursuing a career in surgical oncology over at Fox Chase Cancer Center in Philadelphia, where we will be dealing with complex oncologic cases, and we approach them as what we call a multidisciplinary team. So one of the questions I get asked a lot is, why did I choose cancer surgery as a career path? What most people think of as a depressing and a complex career, to me is a great balance between science and art. And I'll tell you why. Cancer cells divide relentlessly. They grow into these solid tumors and flood the bloodstream with abnormal cells. All that while evading the immune system and outpowering the normal cells. And the reason why I think it's artistic is because every tumor grows differently. They invade into neighboring structures with no mercy. So operating on these tumors, it's like being a sculptor. You have to be delicate with your every move. And on top of that, to be able to work with these cancer patients and their families during those troublesome times is very rewarding. To be able to operate on them and extend their lives is one of the greatest satisfactions in my career. So be on the lookout for valuable content for you and your families, and please feel free to ask me any questions. Follow and share the videos, and I'll see you soon.